In this brief video, I'll be demonstrating the Mayo Clinic sacroiliac joint exam. A very classic finding is the patient sitting offloading the affected SI joint, relatively pathognomonic for SI joint pain. The first thing I typically examine is the PSIS sulcus in the standing position, or the so-called Adams forward bending test position. You can usually see the insertion of the fascia on the PSIS bilaterally, and patients will typically exhibit pain in this area with SI joint pain. I think it's critical to also perform an extensive hip examination during any SI joint patient's initial clinical consult. There is a very strong interplay between hip dynamics and the dynamics of the low back and the SI joint, and looking for symmetry and stiffness and contractures can help. There is also significant interplay with femoral acetabular impingement, and doing some of these tests, such as the Fader test, can help us with delineating true causes of SI joint pain. A very common test was designed by Dr. Fortin, and we call it the Fortin finger test or the PSIS distraction test, and it is employed by pressing directly medial to the PSIS sulcus bilaterally, and this will typically exhibit pain. The Faber examination, or the flexion, abduction, and external rotation test, is a classic test for SI joint pain, but it is typically the least sensitive in my opinion. What is the most sensitive in my hands is the combination of the two forces of the Faber examination and the PSIS sulcus as demonstrated there. Another common test is called the Gainsland's test, and this provides a shear force across the SI joint. I find this easiest to perform in the supine position by dropping the side under examination off the side of the table and providing a contralateral stress on the contralateral ASIS. As soon as you're done with the Gainsland's exam, as you bring the leg up, you can switch positions and perform the sacral thrust, where I post my left hand underneath the PSIS and do a downward pressure or shear effect posteriorly across the SI joint, and this will also elucidate pain in some cases with SI joint pain. In some patients where you may be concerned about their hip stability or if they have some discomfort, you can perform a sideways Gainsland's test, which can provide similar results and is simply a different force and position for the patient. Another common test that is oftentimes asked for is the pelvic compression test, which simply provides a lateral directed force across the SI joints. I don't find this very helpful in the diagnosis of SI joint pain. Finally, I do like to look for dural tension signs by doing the common straight leg raise. If you are interested in an evaluation at the SI Joint Clinic at Mayo Clinic, please contact us at the above email address. Thank you.